Overcoming the imposter phenomenon. This is what me and five of my colleagues came together to talk about because we realized we were having the same experience going through PA program and didn't understand why we were feeling this way. And so the big idea was, what I think others know, does it define what I know? This is what psychologists Susan Imes and Pauline Rose Clancy were trying to define in the 1970s when they defined what we call imposter phenomenon, also named imposter syndrome, also named as imposter experience, as this pervasive feeling of self-doubt and fear of being discovered as an intellectual fraud and despite evidence of abilities. And what they discovered was that people with IP were unable to internalize a sense of accomplishment, competence, or skill. It was occurring across all ages, race, gender, a lot of occupations, and there was a huge prevalence in disadvantaged and underrepresented groups, and no amount of accomplishment could put these feelings to rest. So the problem was, is it bad to be an imposter, especially being in the health profession? As a PA student, we go through didactic and clinical experience, having this feeling of stress, feeling like being incompetent, seeing our peers as smarter than us without even evaluating the situation and going up to them and talking to them about how we feel. And then what we found out that no, it's not bad to be an imposter. It's actually very prevalent. 30% of graduate students experience IP, and 70% of people in general experience IP. So I thought as a student PA stands for personal anxiety. And, having this anxiety was something that was normal and that I was the only one experiencing it. But we found out through our research, especially in the healthcare profession, as a student and beyond, that this is prevalent and it can lead to many things. And that's why it's good to know about it and understand it.
As Zarin mentioned, about 70% of people experience imposter feelings at some point in their lives, and is present in as many as 30% of graduate students. This is despite receiving the training necessary to succeed as a medical professional. And so prior studies have shown a link between IP and depression, anxiety, and self-esteem issues. And it has been found to be the strongest predictor of psychological distress among medical professionals, and is highly associated with physician burnout. And burnout has been found to be an independent risk factor of suicidal ideation. And so specifically, data from multiple prior studies have shown that about 50% of those who met the criteria for IP also met the criteria for burnout and depression, with the highest levels of most burnout indices among medical students. It was found that male and female physicians are 2 times and 3 times more likely, respectively, to die by suicide when compared with the general population. Additionally, in a study of 4,287 medical students, Darabia et al. Reported that about 50% had experienced burnout and that about 11% had struggled with suicidal ideation in the past year. Lastly, multiple studies have shown that while medical students begin their training with similar rates of depression as their non-medical counterparts, their mental health declines as their education progresses. This means that the beginning stages of burnout first emerge at the earliest stages of physician training.
Using the Young Imposter Scale in our needs assessment survey, we learned that more than 50% of respondents, which includes USCPA students and alumni, tested positive for IP symptoms with a score of 5 or greater. As such, it was apparent that there was a great need to address IP within our own Trojan family, and based on the literature review we did, we believed that a peer-led group workshop was the most desired approach to address this need. During the workshop, we had about 36 participants from the class of 2020 and 22s, as well as faculty members that attended. We broke them up into small groups and allowed for them to go ahead and complete a pre-assessment survey in order to gauge their knowledge on IP. We began the workshop itself with a brief introduction on what imposter phenomenon is, its prevalence in graduate student populations, and strategies that are used to recognize and address it. One of those being just talking to your peers about imposter phenomenon. Faculty was invited to present on their personal experience with IP in order to encourage students to be more involved in the actual workshop. Afterwards, group leaders broke up into their small groups and began to share their personal experience with IP and what strategies they used to cope with it. Each member of those small groups was given an opportunity to go ahead and share their personal experience in order to go ahead and cultivate and develop a culture of support and awareness amongst them. At the very end, we discussed 10 practical strategies to overcome IP feelings, and an infographic was provided to all members for future use, whether in the professional or in the clinical setting. Finally, we gathered all the groups back together and finished off with final remarks, and as well as the completion of a post-IP workshop survey in order to gauge its effectiveness and impact on our participants. With respect to the health literacy and cultural competency, all content and resources that were developed and distributed during the IP awareness workshop, as well as the diversity, equity, and inclusive conference at USC, was thoroughly vetted by all members of the group to ensure that the language was both sensitive and correct in its delivery. Of course, our target population were graduate students, so any future use of this material would need to be adapted for that specific target audience. As for advocacy, we're very fortunate to have had Ms. Maldonado and Ms. Hudson encourage us to apply to the Diversity, Equity, and Inclusive Conference at USC, which we were accepted and presented on the main campus. We discussed the IP awareness workshop with our audience, as well as the pre and post survey results. And we were also going to be presenting at the 26th annual Adelante Mujer Latina conference, but unfortunately that was delayed because of the COVID crisis.
To gauge whether IP was prevalent within the Trojan PA family and consistent with our previous research, we disseminated a needs assessment survey to current students, faculty, and alumni. The survey included demographic questions and the Young Imposter scale, where if 5 out of 8 questions were answered yes, it was considered a positive finding. Of the 84 current students and faculty who responded, over 64% of them answered yes to 5 or more questions, and over 75% of them responded that they hated making mistakes, they believed that other colleagues were smarter than they were, they steered away from challenges due to self-doubt, and secretly worried that others would find out that they weren't as bright as they think they are. So, as expected, the results from our needs assessment confirmed that the USC PA program is not exempt from feelings of imposterism and supported the need for our intervention.
So like Michaela just said, IP feelings exist within our Trojan family, and we wanted to address it as a team through our IP workshop. And at the end of our workshop, we asked participants to complete a post-workshop survey because we wanted to learn if what we shared was impactful. Our post-workshop survey demonstrated that the vast majority of participants still believe that 1, IP has a negative impact on their well-being, and 2, that IP and healthcare workers negatively affected patient care. We also learned that 90% of participants reported that they were likely to apply the strategies they learned during our workshop to reduce IP feelings. They also agreed that this workshop would have benefited them earlier in their graduate career and would like to see this topic implemented in the orientation curriculum.
So in conclusion, through our needs assessment, we discovered a very high rate of IP-like feelings within our own PA program. And this wasn't surprising at all because it was very much consistent with the research that we had already conducted, primarily among health professional students. So in order to address this need, we created an IP-specific intervention that was led by our group, other peers, and trusted faculty, during which we discussed IP in a safe space and disseminated strategies to alleviate it. And through our post-workshop survey that was discussed by Michaela and Suchu, you indicated to us that these strategies were effective, that you would utilize them, and that you wish you would have had access to them earlier in your career in PA school. And we hear you. We absolutely hear you. So we have hopes as well. We hope that this intervention becomes a mainstay of USC PA Orientation Week. We hope that this establishes a precedent for USC PA faculty, future and current students to prioritize and better address the well-being of our student body. And we hope to have a larger pool from which to extrapolate data from so that we can someday make associations between sex, gender, age, race, ethnicity, etc. So our call to action, at the end of the day, what we really wanted to accomplish was to bring awareness about how common IP really is. And if we're able to do that, we feel freer to have more open and honest conversations about our feelings, and we know that we're not alone in this. So we challenge you, the audience, to abide by 3 very simple truths. You have talent. you are capable and you belong. And we also challenge the USCPA school to adopt our interventions so that together we can reduce the prevalence of the known IP within our program and better promote wellness among our student body. We know that happy students will someday make happy providers. So let's talk about it. Let's call it out, because we know that we may not be able to banish these feelings entirely, but we can and should have open conversations about our academic, professional, and personal challenges. Thank you so much. It's been an absolute pleasure bringing this topic to you. Have a wonderful day.